But let's talk about the symptoms and signs of hernia. So, how the hernia patients present to the office or emergency room. In fact, majority of patients are asymptomatic, so they don't have any symptoms. And a lot of patients, they can live with hernia for many years without even knowing that they have hernia. Some of the hernias are diagnosed with primary physician or surgeons during the initial examination, or sometimes even we find hernias on patients during doing operations for other problems like appendicitis or gallbladder surgery that we identify that patient to have a hernia. But some of the patients present with a bulge or lump in the abdominal wall, mostly anteriorly, whether it's in the groin or in the mid-abdomen. They come in with a low bulge. This bulge can be associated with pain or discomfort, or can be completely asymptomatic without any pain. Majority of patients that they complain of pain and discomfort, they complain of the pain and discomfort during the straining or heavy exercise or activity, or any type of activity that increase the intra-abdominal pressure and involves the core muscle activity. So some of the patients also can present with complications related to the hernia. We said that the hernia is a weakness or a hole in the abdominal wall. So just imagine when a patient is strained and part of the intestine can come out through the hole and get stuck in that area. We call this complication incarcerated hernia. That creates a very firm and hard and tender lump on the anterior abdominal wall, again, whether in the midline or in the groin region. And that's usually an emergency that needs to be fixed as soon as possible. And sometimes when that piece of intestine goes and is stuck into that hernia defect, it gradually the blood circulations to that piece of intestine compromises or diminish and create necrosis of the loop of intestine. That's called the strangulated hernia, and that's super emergency. And if you don't fix that problem, patient can get very sick and even